hated the beach. But then again, I've always been a beach person. Not my Salvador.
Salvador?
My husband.
You have a husband?
Departed. I told you about him. Anyway, Salvador hated the beach. He said too many people peed in the ocean. What about your Edna?
Edna?
Did she like the beach?
You ever notice the birds?
I'm asking you about your late wife. You're asking me about birds?
At the park, they want you to feed them, but here they take care of themselves.
Here they could die for Clams Casino. What's your point?
I don't know.
I'm asking about Edna.
Edna?
Your wife. Oh, hey. I'm sorry. I guess I just can't take a hint. There's some things about Salvador I still have trouble talking about. Of course, other things I'm not allowed to talk about unless I want the Scarpoli family to put out a contract on me. Hey, I made up that last part trying to lighten the moment. I'm sorry, Alvin. Don't cry. That's okay. You cry all you want.
Ma?
Come in. Oh, Dorothy, I'm glad you're home. You got a minute?
Sure.
Good. Crochet me a scarf.
Ma, I need to talk to you about Alvin. He's sick, Ma.
What are you talking about? You've never even seen him.
I've seen him, Ma. After you had that fight, I was worried about you, and I followed you to the boardwalk.
That was you? Thank God. I thought Gino the Enforcer was out on parole.
Ma, please, will you let me say what I have to say?
Maybe I don't want to hear what you have to say. Maybe I'm happy not knowing anything.
Or maybe you know already.
I'm not stupid. I could see there was something about Alvin that wasn't right.
Ma, he has Alzheimer's disease. I met his daughter down at the boardwalk. She said that when he first started wandering off, she followed him everywhere. She took a leave of absence from her job so that she could take care of him. But she's not going to be able to afford that much longer. The family's discussed sending him to New York. He has a nephew who's a doctor there and can give him special care. And Ma, Sandra says that within the next couple of months, they're going to have to do that.
You know, Dorothy, people think if you live to be my age, you should be grateful just to be alive. Well, that's not how it works. You need a reason to get up in the morning, and sometimes even after you find one, life can turn right around and spit in your face.
I'm sorry, Ma.
Few months, huh? That should give me enough time to finish the scarf.
Hello, this is Don.
And this is Gina with Focused Healthy Family. This is podcast number 116, and today we're talking about dementia.
Actually, we want to talk about what's going on for us. Right now, we're in the middle of doing these Ask the OT, and we're doing more on YouTube now. We've been doing them on Facebook, and we've moved them over to YouTube, working on building our community.
We're going to be doing a couple times a month, short 30-minute YouTube Ask the OT, so you can join in with us. You can ask questions. You can send questions ahead of time, watch with us or after the fact, to get to know Don and I and to understand how we can help support people in dealing with caring for aging loved ones, because we're still growing our community. That you'll have opportunities to participate in longer versions of Ask the OT, as well as other aspects of the program that we are creating around the sandwich generation, and in particular, caring for aging loved ones, even if you are caring for your aging spouse. So you're not really of the sandwich generation per se, but anyone caring for an aging loved one.
Well, and the next Ask OT are coming up. We have one on May 20th. It'll be at 7 o'clock Eastern Standard Time.
On YouTube.
On YouTube, yes. And then we have one on the 22nd, again on YouTube, but this one will be at noon, 12 noon Eastern Time. And finally, we'll have one on YouTube on June 3rd at 7 p.m. Eastern Standard Time.
So we're doing them on Monday evenings at
And-
7 p.m. Eastern Time.
And the Wednesday at
Wednesdays
noon.
noon, not necessarily every week, but be on the lookout for that. You can see the link here to our YouTube page. If you're listening to this podcast, just listening to it, you can also view our podcast on our YouTube channel, and you can see how the cat walks across my lap as we're doing things. Because when I'm sitting down to podcast, it's time to curl up in our lap.
Well, as you said, today we're really talking about dementia.
Dementia. And so the clip we shared was from an episode of Golden Girls. And so Dorothy's mom, Estelle,
So
yes,
her
boyfriend,
good friend,
the
friend from original friend from New York, Alvin.
she was enjoying spending time with, she sits down to tell her that he has dementia. And so that show was back a good
Back in the 90s.
Yeah,
I
it's
guess.
good, almost 30 years ago. And so I feel like at that time it was kind of new, that talk about Alzheimer's and dementia. And there's so much more that's even been understood about it from the medical community, as well as more information for people. And yet, I don't know for the average person how much information you have access to, how many things you've heard about with dementia, because I work with people with dementia and it is in my field and in my education as an occupational therapist. So,
And tonight we're just going to kind of touch on it lightly. We're not going too deep into it.
well, and just talking about the different types.
Yeah.
Some people think all dementia is Alzheimer's or all dementia looks a certain way. When my dad, his dementia was getting worse as his Parkinson's dementia, he was going to a kind of a day program, and a lot of people there did have Alzheimer's. And he kind of had the impression from the media images of dementia, which is typically Alzheimer's, that eventually he was just going to not be able to understand, who know anybody was. And the event, that was his path, that eventually he was just going to be so out of it. And I was like, wow, that's what he's thinking. And it's not that way with Parkinson's dementia. It's very different. And even his ability to recall things is different than someone with Alzheimer's dementia. So we thought we would just touch on some of the different types of dementia.
Well, and just to kind of throw in here, one of the reasons that I know I wanted to do about dementia is it happens to be Dementia Action Week, and it's put on by the Alzheimer's Society. It's running from May 13th to the 19th. So that's kind of what spurred this idea of talking about dementia. And I wanted to ask
Also
you,
Speech Therapy Month, I believe.
I wanted to ask you, Gina, I just kind of, I look at Alzheimer's versus dementia and kind of trying to understand what the difference is. Now, my way of looking at it, and this is where I want you to help me, is I look at Alzheimer's as kind of the next level of dementia. Would that be true?
Alzheimer's is a type of dementia.
Yeah, it just seems like it's like
There are different types of dementia, and one type of dementia is Alzheimer's dementia.
So it's not really.
Each type of dementia has different stages to it, because you have a stage of early Alzheimer's dementia. I don't have the exact stages in front of me, but versus late Alzheimer's looks different than early, when the early onset of it, when they're just forgetful and having trouble keeping up with things, versus the kind of end stage, so to speak, of it is that they can't remember how to feed themselves and they don't know who their family is. And so there's a progression of Alzheimer's. But Alzheimer's is, you have the category dementia, and then you have all these different types, and Alzheimer's
Okay.
is one of those types.
Okay.
That
Well,
makes
that was curiosity on my part because we talk about them like they're different. And I mean, it kind of, oh, he has Alzheimer's. No, he has dementia. You know, I've
a
heard
lot of
people kind of,
times they identify dementia, but not necessarily the type.
yeah.
So now, because of the advances in medicine and technology, with a CAT scan, I believe, or an MRI, they can identify plaques on the brain that indicate that this looks like dementia. I actually had a patient recently who had an aneurysm, so that presents as a stroke. It was a hemorrhage in her brain. And doing the CAT scans to look at that, they discovered that in addition, she has Alzheimer's. That the the plaque and the way it looked was indicative of someone who also. So this poor woman who's just had this massive brain hemorrhage, which causing total paralysis on one side of her body, affecting her speech and so many other things. It's enough to have that and to have recovery from that, because as the brain swelling calms down, you can have recovery. But then to have Alzheimer's on
Okay.
top of it. But the fact that they are able to identify that, 30 years ago when the episode of Golden Girls was made, they weren't able to identify Alzheimer's until someone was deceased. So those are, big advances that are happening that make it easier to identify the type of dementia, because sometimes people get misdiagnosed with what type of dementia they have. And it can be very important to go to someone who really specializes in this, because some general practitioner doctors might put a label on somebody, or somehow a label comes about. I worked with a patient in an assisted living facility, and I'm pretty sure it said Alzheimer's on her medical record. And I don't diagnose people. That's not in my role as an occupational therapist. And yet, from a functional perspective, she did not have Alzheimer's dementia.
What would you have thought that she had? You know, did you have a
I'm
thought of
pretty,
it?
I,
Do you
I,
remember?
I remember, I think it was Parkinson's. It's been
Uh,
many years ago. We've had a number of people who were, because sometimes Parkinson's doesn't get diagnosed till very late when it, but there's some key signs of it earlier, especially when you're talking about the cognitive aspects of it. Um,
well, and Parkinson's, is it have some form of dementia as part of it?
so not everybody
'Cause
with Parkinson's develops dementia.
I was going to say, I think they define it. You know, I did some research this afternoon from the dementia.
Yeah, so let's back up a minute, Don, and
Yeah.
so Alzheimer's disease is the most common form of dementia. It affects memory, thinking, behavior. Don printed out some information.
Well,
It's a physical brain condition. So there's changes in the brain, and where the person's abilities deteriorate over time. You can have early onset Alzheimer's, but typically you see it over the age of, it doesn't have an age here, but I would say over the age of
I think 65 was kind of
65.
common through because there is one called a youth or younger onset dementia. It and they really didn't define it too much except to say that it's dementia that's taken on before the age of 65.
Yeah, and I've heard of even younger ages. Like, yeah, I don't know what the criteria, and we can go into, we'll have a whole podcast on Alzheimer's, that, early onset, maybe in the 60s. And I think part of it is that people probably had signs of Alzheimer's in their 60s, but it typically doesn't get diagnosed until 70 plus. But someone who has it as early as maybe under 65 is considered early onset. I know my mom had a friend who had early onset, and so yeah, it can affect people of different ages, and it can present differently. It can progress differently for different people.
Well, you know, and thinking about it, the fact that, like I say, with the Golden Girls in the 90s, I think what was happening then was they were actually starting to define it differently. You know, before that time, anybody that had the loss of memory, it was just that they were getting older, and it was just a part of aging. And I think,
Well, and
you know,
Alzheimer's was becoming more understood.
yeah,
I'm sure it had been around longer than that, but just as far as it being common for people to understand what it was and to, these terms, there was a time, what the senile dementia
yeah,
is what they used to
yeah.
call it. If you go further back, I'm sure there were other names for these
Oh, I mean,
issues.
yeah, they were crazy, or they
Yeah.
were,
Well, and part of it is that people are living longer, so you're seeing higher incidence of dementia because some of the goes along, not that normal aging involves dementia, but you see it more commonly as
mm,
people get older, and therefore, when people only live to be 65, you saw less incidences of it.
that's true.
And so they do talk about you're more likely to develop Alzheimer's if you have a history of physical inactivity, lack of mental exercise, smoking, obesity, diabetes, high cholesterol, and high blood pressure. And I know there's a lot of talk about keeping your brain active and
Hmm.
exercising your brain. I talk about this a lot as an occupational therapist, that just like you need exercise for your hands, your arms, your legs, your core muscles, we need to exercise our
The brain.
brain.
Yep.
And we could do a whole podcast on that of
They just need to do connections.
New York Times word puzzles. If you want to sponsor us, New York Times. Um, and so let's jump into vascular dementia, because this is one that's often
Misdiagnosed,
or
kind
not
of.
recognized. So this is caused by restricted blood flow to the brain. And so, I mean, you see this a lot. Someone who's had TIAs, which are mini strokes, or sometimes you can have a mild stroke, but it not manifest in serious symptoms. So you're having a decreased blood flow to the brain, and you can have vascular dementia go along with these things. And I know we saw that in another family member. And so it's caused by the damage from the restricted blood flow. Um,
One, I think in my own heart attack, I think not that I had dementia, but that it did play the lack of oxygen
Oxygen.
and blood flow caused some cognitive
And
shifts in me.
could that affect you down the road? I
Yeah.
mean, um, yeah, those are good questions. And what I'm reading here is that it can go alongside with Alzheimer's dementia. So these are different types, but you can have a restricted blood flow along with the plaques and tangles associated with Alzheimer's. So it can be a complex combination of things, but some people have vascular dementia without having Alzheimer's.
Well, and if you look at the top, they don't even they don't really they say types of, but then underneath it says more than 100 different medical conditions that can lead to dementia. So are these really just different, you know, kind of conditional parts of
And yet
what
they
dementia is?
clearly manifest differently
Yeah,
and progressed. I mean, Alzheimer's has a definite progression. Yeah, I don't know there's been anyone with Alzheimer's who's been able to, stay at the, versus a vascular dementia, it could maintain at one level for that person and
yeah,
not get any worse, and be mild in format, just like you see sometimes with Parkinson's. And the different types of dementia affect the different aspects of your brain functioning. And this is one area where it's very different with Parkinson's dementia. But before we get into that, it says you're more likely to develop vascular dementia if you have a history of high blood pressure, high cholesterol, diabetes, obesity, smoking. Some of these are overlaps,
yeah.
physical inactivity and poor diet, heart rhythm abnormalities, heart disease,
Yeah.
blood vessel disease, a large stroke or multiple strokes, or TIAs, those mini strokes that often go undiagnosed because they don't show up on scans. It's kind of with a stroke, you have a clot that blocks the blood flow in your brain. So it stops it completely. A TIA is like a little clot that just does a little pause and then it keeps going. But it can do some damage in that process. Your mom had
Yeah, I remember.
TIAs
Well,
and
and didn't you? I'm trying to remember if you, with my mom, didn't you say something about vascular? I think at the time that you thought that was what was
I think
more of
she
what
was
might
even
have been going on.
diagnosed with vascular
Oh,
dementia, possibly. Yeah. And well, and then I think she had an undiagnosed stroke as well. That's a whole nother.
well, and what was just as a little side note, remember we were so concerned about it because she was running into things, and you thought she had, peripheral issues, which she may have, but
On
then we
top of it,
found
then we found out she didn't have her glasses.
somebody had
And
taken her glasses, so she was walking around. If she had, I think she had eyesight very similar to mine. Without it, it's kind of blurry and fuzzy, and depth wise and all that. So who knows what was how much it played into it, but it was
Sure.
just kind of
Well, it's like when I work with people, sometimes they're not answering my questions properly, and I have to determine, is it a hearing problem or is it a cognitive problem? Sometimes it's both.
yeah.
A lot of times it's both. But sometimes it's, if I write things down and then they can answer me clearly, because sometimes they'll just answer something, even though they don't really hear what you're saying. I asked somebody, oh goodness, see if I can think of this. I asked her something about like her house, if she had steps or something. And she told me like where she grew up. I mean, she just answered with a totally wrong question. And I think it was about hearing. When you can't hear well, you try to figure out what people are trying to say. So you're not saying what.
What?
So now we get into Lewy body dementias.
This one is I'm really curious about this because this was what Robin Williams was one of the things
I
he was
believe,
diagnosed
well,
with.
in Lewy body dementia is similar to Parkinson's disease, but it has some differences. And so there is Lewy body dementia and there is Parkinson's disease dementia. Those are two different types. So Lewy body dementia it's an umbrella term describing two forms of dementia with Lewy bodies and Parkinson's disease dementia. So Lewy body dementia is often a younger age of onset, people who have that, and it's often a more rapidly progressing, and you see the cognitive impairment from the start. Whereas with Parkinson's, it doesn't start typically with cognitive impairment. It starts with the motor impairment, maybe a tremor or the freezing when walking or shuffling the feet or things like that. But there's a lot of overlap because it is in the kind of same area of the brain.
Yeah, I didn't put as much of the Parkinson's down out of this because I figured you kind of knew that part of
It
it.
kind of describes it. They're grouped together because it's the same area of the brain is affected. A Lewy body is a tiny tangle of proteins called alpha synucleo. It doesn't look like that's written right, but inside brain cells, these tangled proteins cause damage that affects your movement, your thinking, and your behavior. Over time, Lewy body dementia develops, will become more affected. So the difference is dementia with Lewy bodies can cause these symptoms with these differences. Stiffness in your torso, earlier balance problems, symptoms on both sides of your body,
Well, that's
resting tremor.
Lewy body goes faster, like you mentioned, or tends to progress faster.
Well, not everybody diagnosed with Lewy body dementia will be diagnosed with Parkinson's disease. Yeah, this is my first time reading where you've got this. This is one source of this information, and if we go into more detail, I would pull up more sources from it. But from my understanding, yeah, if you see that early onset of Parkinson's-like symptoms, but with the cognitive component, and the people that I've seen it in, it's often a younger age of onset,
Yeah.
and it has a rapid progression to it. Like the people I've seen, they're in assisted living, they get diagnosed and they quickly wind up in memory care and they rapidly go downhill versus someone with Parkinson's can have physical symptoms, like if they get diagnosed early with medications, they can manage, like my dad did for a
Yeah, for a
long
long
time. I
time,
mean,
yeah.
he was diagnosed so early, I was surprised because there's not a definitive way to diagnose Parkinson's. You rule out other things and it's based on symptoms. They can't go into the brain at this point and determine that's what it is. And so they started my dad on the medication, and for the longest time, no one would have known, and he managed really well. And then they had to up the medication as he started having issues with freezing. So it's your procedural memory with Parkinson's and Lewy bodies. So knowing like how to stand up and turn, like sit in that chair involves standing up, turning your feet, backing up, reaching back. So those kind of procedural tasks versus, who is this person standing in front of me? What did I eat for breakfast? Those other kind of, deficits that you see in other dementias and in Alzheimer's disease with memory and recall of information. With Parkinson's, you see it affecting more their daily functioning, being able to eat, being able to get dressed, coordinating the shirt, being able to orient it the correct way. I've had patients put their shoes on the wrong feet. And this what you call freezing is like just that, like my pause in my speech. You go to get up and you just can't get
Is it the thought or is it the action?
well, it's the brain controlling. The brain tells your body what to do. So it's that signal. And so like when I work with people, some types of dementia, we break things down and we say, stand up, now turn, now back up. So someone with Parkinson's, they can't follow that. They need sit in the chair, because if they try to break it down, that's when they get frozen and they can't isolate those movements. So there's a lot of things, but that's more the movement, the physical aspect of Parkinson's disease. And so with Parkinson's dementia, you can see short-term memory issues. You can see Parkinson's is often associated with hallucinations. So seeing things that aren't really there. And then there's delusions, which are thinking things are happening that are not really happening. And that can be even more of an issue. And they can have vision problems with depth perception. So there can be a lot of things going on with Parkinson's that looks like dementia, but is not really. It can be more visual, more of these other aspects. And so not everyone who has Parkinson's disease develops dementia. And a lot of people I've worked with Parkinson's disease who do develop some dementia, it can be very mild and it can remain mild. My dad's was mild for a very long time, and with having back surgeries, which anyone with Parkinson's disease going through surgery, going under anesthesia can exacerbate the Parkinson's, both physically and cognitively. And then the isolation from COVID, he didn't develop COVID in the first years, but their community shut down. He couldn't go to all the activities he was doing. So when you talk about minimizing dementia by doing, brain activity, keeping your brain involved, being active with movement, right? So he didn't have access to all that. And
he
so
loved
that
golf and he fished
and that can exacerbate dementia. And then unfortunately with, dementia, you can't reverse it.
Yeah.
Now, many dementias have moments of clarity, and definitely with my dad with Parkinson's dementia, he has moments where you can have a conversation and it makes sense. And sometimes you have a conversation and his words are clear, but you don't know what he's talking about. And sometimes with his speech being an issue, you can't even understand him. So yeah, it can look differently. So it's, he has Parkinson's with now advanced dementia, but a Parkinson's type of dementia. I don't ask me questions, Don, because this makes perfect sense in my brain. But
No, you
from
do.
a lay person's point of view,
I was just going to look at the next one. I don't know, the younger one.
So
like
younger onset dementia, people under the age of 65. Okay, so that's kind of their cutoff. So early onset Alzheimer's then is most likely. And again, we'd have to look that up.
And they really talk about there's not a lot that they can do to really diagnose it, or they can do some things.
Well, there's cognitive assessments. Now there's cognitive assessments that you can do. There are several different standardized cognitive tests that you can do to look at if there's signs of dementia, because there's what's called mild cognitive impairment. If you watch the show This Is Us, in the latter years, spoiler alert, the mom
Oh, yeah.
gets diagnosed with mild cognitive deficit. I said spoiler alert first. And so that's before you get to dementia. It's kind of like early stages of what can turn into dementia.
Where it
And
kind of comes and goes as far
well,
as
it's more mildly affecting yeah, it's not that it comes and goes, it's kind of just the earlier stages. And yet, from my experience, someone can have a mild cognitive impairment, but not have full on dementia and can live that way, to 100. And,
Mhm.
I have 100, don't bite my arm. I have
You're not paying enough attention to the cat.
I have older patients. I've got 100-year-old lady who's had some illnesses and she's had some mild cognitive impairment from it. Yet she doesn't, in my experience, stop biting my arm. In my experience, doesn't have a diagnosis of dementia. You can have some memory issues, you can have some mild cognitive impairment, especially infections, medication, illnesses can, we talked about that earlier. Okay. Any other thing to wrap that up or make that clarify? Now that I'm not being bitten in the arm by my cat, she's not biting hard, but it's just enough to be annoying.
Just enough to get your attention. Well, the next one is a frontotemporal dementia,
Yes.
and that has like 4 different types of that too. So I don't know how far
And
you
that's
know,
one that is another
are
kind
you
of,
familiar with that somewhat?
yeah. And I don't see that as much. And again, this goes to diagnosis. This goes to going to a qualified professional. My dad goes to the Movement and Memory Center. They really specialize in movement and memory disorders. So they see lots of people with Alzheimer's and Parkinson's. And I would imagine they would clearly diagnose people with these different types of dementia. If you go to, we also took my dad to a neuropsychiatrist who specializes in geriatrics. So you really need someone who's got familiar with these different types and understands it clinically to be able to differentiate. So frontal temporal dementia, it affects the frontal and temporal lobes of the brain.
Well, the different types depend on where in the frontal it hits or
Right.
where it affects.
So in a general explanation, our frontal lobe deals with our impulse control.
Have to brush up on your
The words are not coming to me. So your impulse control, your making decisions, your filter. Someone with any kind of frontal brain injury of any kind, whether it's dementia or brain injury, they lose their filter. They will just say whatever. They're impulsive. They randomly do things. And so that, the particular area of your brain that's affected, whether it's by a trauma, brain hemorrhage, strokes, or a dementia, that's why it affects it differently. And so, okay.
So the behavioral affects the frontal lobe first. Primary, it affects the temporal lobe first. Progressive, progressive
So
non-fluent aphasia.
okay, so aphasia is your ability to express or understand. So there's expressive aphasia is my ability my brain to take what I want to say and put it into words and speak it. So someone could not be able to speak and say things very well, but they might receptively understand. I work with a number of patients like this, and unfortunately, caregivers and things often think, oh, because they can't talk, they don't understand what I'm saying. And when someone who expressively has aphasia, they're just having trouble. Their brain's not allowing them to put into words what they need to say. Versus receptive, your brain can't, someone's telling you something and it's not making sense out of it to know what to do. So Yeah, so they're talking about with frontotemporal dementia in the early stages, your memory isn't always affected. So you can have dementia that doesn't affect your memory,
Hmm.
but affects other aspects. Like I talked about the frontal region, your impulse control, your decision making,
How
your
you express,
your ability to monitor your
understand.
behavior and be appropriate in situations. So you can have good memory and make bad decisions. And there's a particular patient years ago that had she had a frontal, either a hemorrhage, yeah, aneurysm, from the brain injury unit, and she had no awareness of the seasons. And like I had to take her to the window and like walk outside, and like she thought it was winter and it was like summer, and
Mm.
and just her impulse control and ability to make decisions, and was just um so yeah, so that's affecting different areas of the brain. um Progressive aphasia, semantic dementia, progression of non-fluent aphasia. So yeah, it just affects different areas of our body.
Well,
And so, oh yeah, okay, there's a whole different types of frontotemporal dementia. So, you can obviously look this up. You can learn about this. If you have a loved one and you don't know, you can read about the different types, not to diagnose your loved one, yet,
help
to
understand.
help understand and to ask the questions. And if you're asking these questions of the doctor, the doctor might say, oh, it doesn't matter, dementia's dementia. It helps to understand what it is, to be able to understand what they're going through, because we might underestimate what they're capable of and what they understand and what they can do. And I think diagnosis is important in getting the right treatment, and the awareness of things. Years ago when we just thought people were senile, and we just grouped that under one big umbrella term, when yet it is so different for different people.
Well,
And
and
so finding the right
it,
provider who can help determine.
well, and then by understanding, one of the big things we talk about is communication, and by understanding what their diagnosis is, it might help you in how you communicate and what because if they have the aphasias going on, and you know that they're comprehending it, it'll help you to be able to still talk with them and work with them and figure things out.
So yeah, just to go into semantic dementia is when you lose the ability to assign meaning to words, to think of the right word or name people and objects. So these people might still have
Memory.
just your reading, spelling, comprehension, and expression aren't usually affected. You might also keep your decision-making ability, but the word finding, coming up with the right words, and even, yeah, if someone says things to you, they might not even be able to interpret the meaning of those words. So you see this a lot. People say they have senior moments when they can't think of the right words for things. And it's something that we can all encounter to different degrees, but
Mhm.
it's not part of normal aging. Well,
Well, I mean, I think like for me, the words do eventually come to the like it just I'll I won't it'll slip out of my mind at the moment, but if I just kind of take a moment, a lot of times it comes back to me. Whereas somebody that's having that kind of problem, it probably wouldn't come down to them at some point after a while. At
well,
least,
and yeah, sometimes they can come up with it. It takes them longer. They might stutter. Um, but just, yeah, there's a difference between just forgetting a
yeah.
word. And there's also, there's different reasons for these things. And, you know, impairment in your cognition is not really a part of normal aging like people think it is. I have worked with many people in their 90s who are
Oh yeah, sharp as a
clear
whip.
and
Yeah.
sharp and good memory. Yet because we don't always take care of ourselves, we don't always take care of our body and our brain, and then we can start to have some different changes that would not be there if we were able to better, and depending, of course, on our genetics factor. So, then you have things like alcohol related brain injury,
Oh yeah,
like,
they even mentioned here they kind of took out the dementia to it and put injury into it instead, because
Well, it's like,
it has some recovery ability to it.
sure. And that's, when I was talking about, cognitive damage, your ability in thinking and reasoning, and that can happen with a stroke, yet you can have more recovery. It looks different than a progressive illness
Mm.
like Alzheimer's or Parkinson's. You can have Parkinson's onset from trauma, like the famous boxer,
Ali.
Muhammad Ali. So from the traumatic injury to his head caused the Parkinson's disease. Might he have developed it without that? Who knows?
Well,
But
that's the you're talking about the chronic. It's mentioned in here. It's
okay.
chronic traumatic encephalopathy. I can't even say.
Well, there's different, I mean, you can have that and it not look like Parkinson's, though.
Um,
You can have traumatic encephalopathy is inflammation of the brain, and that can cause other dementias and difficulty in the brain function. So, yeah, there's a lot of different things that can contribute to
um,
aspects of dementia, and yet they manifest differently. And so it is important to know, so that we, like someone with an expressive aphasia, your mom had this in her late last year. She couldn't put into words what she wanted to say, but she understood far more
mm,
than she could say. There's a type of it's not Parkinson's, it's very similar to it, and the name's always blanking from me when we go into that in more detail. It's doesn't seem to be as common, but it has some significant differences, and she has significant expressive aphasia, like compared to my dad. I mean, people think she can't talk. I explained this to a caregiver recently, like, no, she understands what you're saying. She just can't get the words out, that semantic dementia that she has from her illness. So these are different types of dementia. And if you have particular questions about them, look forward to joining us for future podcasts where we're going to speak to other professionals. And if you really want to get into it and thinking about your aging loved ones and what can we do to help, then look into our Ask the OT community that we are growing right now. We're growing the community on our eParent page on Facebook. And within that community, we're going to build we're
resources.
we have resources. We're storing all the Ask the OTs that we do there, and we're going to be having more in-depth Ask the OTs within that community. So we're doing ones to get the word out, to be able to interact with people, without charge on YouTube. Yet, if you want to be able to talk specifically with different professionals on an Ask the OT and to get more specific answers to your, support and help with your situation, being part of that community, you can add on, individual service with Don and I. I've talked to my coworker who is a speech language pathologist, so he deals with cognitive issues and dementia, to come on to the podcast and to come on to our Ask the OT. And we're going to be bringing on different people like this. So be sure to look for more information on that if you're dealing with caring for an aging loved one, and do stay tuned for future podcasts. We do continue with our podcast to share information on all things related to caring for our children, our parents, and ourselves.
Well, and that's our podcast for today, and we hope you have enjoyed it. We'd love to hear from you. We love comments. We love you to join in with us and chat with us. You can come on the Zoom as we do these different OT, Ask the OT. You also can, if you like what you heard, you can learn more about our parent coaching program, our consulting that we do for people that are dealing with aging parents and like the sandwich generation. You can find out about our workshops, our blog, of course, our podcast. We have Tuesday tips, which are every Tuesday we have a podcast a small podcast that gives an effective tip for a parent, but we also have it in email format, and you can sign up on our website, the Focused Healthy Family website.
And that's a more of a generic parenting tips. Sometimes we share things that can apply to aging loved ones, and we're going to be starting.
We're going to be doing
we're going to be doing a similar one for this caring for aging loved ones in addition to the Tuesday tips. So be on the lookout for that. And remember to like this podcast. If you enjoy it, share it with other people. Provide us feedback on this podcast. It helps us get it out to other people who want to hear this information.
And of course, we're on Facebook at Focused Healthy Family. We're also on Instagram at Gina.FocusedHealthy.
No, at Focused Healthy Family.
Well, that's right. We changed.
We're updating our Instagram account.
Yeah, we're like
We've
kind of putting this all together, and
we're updating it. We've got someone who's providing us with some support for, so that's going to be changing and improving.
and remember, how you speak to your children, and of course your loved ones, today shapes their future and yours.